Hi, it's Janine. It is 3 weeks and one day. I just had my 3 week appointment with my doctor and I got cleared to drive. And I'm not taking any oxy or any pain medicines. I take a muscle relaxer at night, and sometimes if I need it, I'll take some Tylenol. I still take those Tylenol packets. My throat is still kind of swollen. I don't choke as much. I was choking a lot. I don't choke as much, and but it still gets like stuck right here a little bit, and then I just have to wash it down with something to drink. And then sometimes larger pills get stuck, but that is getting better and better. And he says, as long as it continues to get better and not worse, then that's great. If it doesn't get any better, or if it gets worse, then to call them, and I would go to an ENT and have them scope my throat and see if there's anything going on and go from there. So that's going really well. The scar is healing really well, and it is large. And I asked them about it, and they said it's just because we did 3 levels, so there's so much space to get to that it is going to be a larger scar, and that's just the way it is, and I'm fine with that. I just was like, okay, was there a complication or something, wrong? They said no, nothing was wrong. Everything looked great. Everything went great. I decompressed well, and I got a picture of my x-ray. This is the first time I have had a curve in my neck. I have never had a curve in my neck. A little backstory is I was in an accident when I was 7 years old, and I hit a car and smashed the side of my face. That's, I believe, the cause of my jaw issues, a lot of sinus issues, neck issues. And as long as I can remember, even being a teenager and into my 20s, 30s, 40s, all the x-rays that I have ever had of my neck, they've always said that I have a military neck, where it's positioned forward, as you can see in the before picture. But of course it got worse and decompressed as I started to get older. And because it was like that, there was some bone formations and stuff that were actually holding up some of the vertebrae that they showed me before. But I knew that because it's been like this for many years. But the reason why I started and I wanted to get the surgery was because I started having problems in my hands, my grip, some pain in my arm, and besides just the pain in my neck, we tried many things for the pain itself, which didn't work for long. So there was other things that were going on why I decided to finally do the surgery. I didn't want to lose a lot of my hands, and I started feeling like I was getting carpal tunnel or maybe some tendonitis or something like that in my right hand, and it was bad. It was really bad before surgery, where I was like, I almost went to a doctor prior to surgery to have it checked out because it was hurting so bad that I was wearing a brace sometimes on my arm. I woke up from the surgery, and since the surgery, when I woke up from the surgery, absolutely no pain. Well, yeah, I was on a lot of pain medicine and everything else, so that could have contributed to that, and I realized that. But I have been off pain medicine for well over a week. And sometimes I have worked on the computer for like 2 hours at a time, 2 or 3 times, and my wrists kinda, sometimes it ache a little bit from being on the computer. So I don't know if, and I have had tendonitis in my wrists before from doing so much computer work and driving. So it's very possible that that I have that again, but the surgery, since the surgery, it has been 100 times better. It's like the pain is every now and then a couple times. Like I think it's hurt like twice. It's no big deal. So that, and I'm not getting headaches every day. I usually wake up with a headache because my neck, because I sleep in this thing, and it digs into the back of my head. And I talked to my doctor today, and he says, that I can sleep in the soft collar, or even sleep on my side with this on, or the soft collar, as long as I stay very neutral. Which I might just wear this as long as I can sleep on my side, because my mid back just starts to really hurt, and being able to move around some, I wake up very stiff, and because this digs into my head, I'll wake up with a headache. But once I get up and get moving around, that goes away. It all pretty much resolves itself as I get up. So I'm going to try that, start doing that. He says I can walk on a treadmill. I have been walking every morning. I started about a week and a half. And my first time was like around the block, and that was it. But now I'm going, I'm a little over 2 miles. I just walk around. It's all flat, pretty much. I mean, very little incline. It's just in an industrial area. So I get a walk in every morning, but I'm going to have my husband put up my treadmill. I have a small treadmill that I used to use under my desk, and I'm going to have him set that up so I can, during the day, just if it's just for 15 minutes to walk, because it's quite often too warm by the afternoon for me to walk. I also have other health conditions, which I'm not supposed to be out walking in extreme heat, or really any heat over 75, or exerting myself if it's over 75 degrees, which I do, and I've had this all my life, so I have definitely done that before. But with this restriction on top of that, I don't want to push it. So having the treadmill, I can at least walk slowly, work on my posture, and he says that's very important. And something that he did explain to me, why some people are like, yeah, I don't know why you have to wear the collar for so long, or why we have to wear the collar. Well, for me, this was for me, he explained that my neck had been so straight for so long that it is not used to this curve. So now that it's got the curve in it, all my muscles and everything, they need to be retrained and get used to this whole new posture and holding myself up and stuff. And especially until all that happens and my neck starts fusing, if I was to not wear this and I started leaning forward and really relaxing and letting my head go forward, which I would naturally do because I've been like this for 50 years, so my neck would fuse that way. And oh, that beeping was, this is a bone stimulator. This is what it looks like. Okay. So if I was to do that and allow my head to go forward all the time, then my neck would fuse that way, and then I would definitely be like that forever. So in order to have the curve and to keep the curve and to have it fuse in that direction that we want it to be fused, then wearing this as much as possible. You know, he said if I'm just relaxing, if I can keep neutral, I can take it off and let myself breathe, and take it off to eat and stuff like that. Because sometimes eating with this thing on, especially at first, now I can loosen it down and pretty much get everything down with just a gulp. But it is easier to eat if you take this off, because then you can dip your chin down to actually swallow and make sure everything goes down and you don't choke or cough or something like that, which I have done quite a bit of. Another thing, and I was able to do my hair. I am so glad that I cut my hair, because it was so heavy before, and it would have been difficult to do. Just the heaviness of it would have been a lot. It would have been very heavy for my neck in the shower to hold, because even with just this much hair, I still split it down the middle and pull each to the side, pull, you know, one side to each side, so it kind of distributes a little bit, because my neck muscles kind of feel weak. So I still do that, but I was able to blow dry it and then somewhat curl it. It was not easy, because if you're a girl and you're curling your hair, you typically turn your head to the side so you can reach, especially the back, where I just had to kind of grab and pull and just kind of do it. But I did it, and I feel better being able to at least do my hair a little bit. What else are some things? My legs are getting stronger from all the squats that I'm doing, because you can't, or you're not supposed to be bending straight over. Although he said I can bend over, because I do wash out my nasal passages, just to breathe better. I have birds. I have a lot of birds, and I'm somewhat allergic to them. So to keep from getting sinus headaches, I wash out my sinuses, and it has now become to where I like to do that. So I do bend over, but I make sure to keep this on, and it's not as good as like I did before, but it is able. So if you're bending at the waist, you know, he says you can bend down that way, as long as it isn't for very long. It's very brief, and it doesn't hurt, and I'm not twisting or bending my neck itself. So I'm not doing this, which you can't really do that in this. So I can do that. I can bend down. I pick things up off the floor. I do a lot of squats. When I load the dishwasher, I take things and I squat down and put it in, and I bend over like this, and I try to keep my head in a very neutral position. So all the time I'm always thinking about keeping my shoulders back and down, keeping my head in a neutral position, and trying to get used to doing things that way. So my legs have gotten stronger, and my abs have gotten stronger, because when I get out of bed, I do hold the back of my head to sit straight up. Well, just doing that so much, at first I was in bed quite a bit, so anytime I wanted to get up and go to the bathroom, or get up or switch anything, get something out of the cart, which I'm still using the cart. I love that cart. It makes things very, very useful and convenient, very convenient to be right there, because I'm still sleeping at a slight incline. So doing all that, I'm getting some ab workout and just walking, you know, walking straight, trying to walk in a correct position, and all that. You just you start to use muscles and things that you don't typically use. I did get authorized to work, to start working. I work on a computer at home, so it's not like I have a big commute or anything. And I just from here to the living room or to the office, to my office. So, but I told him I've done a couple hours here and there. I've done it a few times at the computer. So he says, let's, you know, if your work will authorize it, just start 2 to 4 hours and just work up to it. For the next 2 weeks until my next appointment. And then else, the bone stimulator, it is very light. We're at 4 hours a day, every day. It does, if you're on the phone or if you have earbuds in, you'll hear this buzzing sound. But if you have, I find that if I have my phone on speakerphone, I don't hear it. But if I have earbuds in or I have it too close to me, I can hear it. As far as my jaw relation, that is going well. This, especially at night, I think I push down on it just out of discomfort. And like this morning, I did feel, you know, I felt sore, or where my jaw was sore. But I think that's just from pushing down. So I'm excited to possibly use my soft collar at night, or even possibly dial this down so I have a little bit more room if I'm able to sleep. So I'm gonna have to experiment with that. But as far as I can tell, I haven't measured my jaw opening yet, and I haven't used my Therabite, which I probably should take this off and use my Therabite once a day or once every other day, because I don't typically, I'm bad at that. I used to do it like once a week, but I haven't done it at all for probably 6 months. So I should probably take that out and just put it on the counter, so when I get out of the shower or something, I can do a session of the Therabite. If you have jaw surgery, or if you are looking at their jaw surgery, you might know what a Therabite is. Basically, it's a device that you put in your mouth and you squeeze a handle, and it opens your jaw up and it stretches your jaw muscles to keep your opening wide. Because with jaw surgery, your muscles can start to shorten again. When you have jaw surgery, your opening is not very well. You know, it might be one finger like this, or 2 fingers. Some people don't even have that. Some people don't have a, you know, they can open as wide, but most people, they can't open their mouth that wide. So when you have the jaw surgery, your muscles have shortened because they're not being used, they're not being open, and they have to be stretched out and stuff like that. So that's part of the therapy for jaw surgery patients, is to have a Therabite, or to be able to stretch their mouth opening, which is what you have to do for pretty much the rest of your life, because to keep that jaw opening, you need to continue to stretch. Like any muscle, you need to stretch that muscle so it will stay limber and allow you to open your mouth as wide as you comfortably want or can. As far, let's see, the scar, it is kind of tender, but it doesn't hurt like all the time, but it's, you know, it's a little tender, and it's like right here on this top side, it's got a little bit of a numbish feeling, which I totally expect, being that, you know, nerves and skin and muscle and everything else, not muscle but tissue and everything were cut, and things were cut in there. So it's expected. I've had it on my jaw surgery sites, and other surgeries. That is nothing abnormal. I do have a hump in the back at C7T1, right at the base at your neck, where those bones are the longest. Well, because my neck was forward, and you'll see it in the X-ray. I'll put that up again, and you'll see that the when it's forward, my skin's all smooth here. But when I get this, you'll see that I have like a little crease, and you'll see a bump. And I'm sure that it's tissue and some swelling, but I asked him, and he says, yeah, he says, you know, it's normal. He's like, but it might be, yeah, just because of the position, and then now the curvature of your neck, where it wasn't, you didn't have that before. So I don't really care. I just was like, is this supposed to be like this? Because it was never like this before. I didn't have a little hump thing, but now I do. So showering, I shower without a collar. I just hold my head up. I don't know if you can see this, but I'll hold at the base of my neck and kind of just pull up a little bit, so I'm, supporting my head so that all the weight isn't pushed back by my hair or whatever I'm doing. And it feels good. It just feels good. It feels good to have that support while I'm in the shower. But I always still try to, instead of hunching over and going, oh, okay, be careful. No, I try to, okay, up straight. Let's elongate everything and add a little support. And I'm doing fine with that. I can wash my own hair. I do to shave legs and stuff. I sit down and I put my legs up on something. We have a bench in our shower, so I put my foot up on the wall, or I put it up on a little shelf or something. But I can shave my legs, and when I'm bending over in the shower, again, I make sure that my head is back, shoulders down, stay as straight as possible, and try not to look and bend. I don't do the best shave job, but gets the leg whiskers off. Everything else, it's going great. I'm feeling good. Overall, I'm feeling really good, and being on less medication just on a day-to-day basis is great, because I'm not on any anti-inflammatories. I'm not on any pain medicine. I'm not on anything, and I think that could have been, well, probably was contributing to some brain fog, and then on top of that, pain and not sleeping well, and all the muscle relaxers, because that's all I could take. So I was taking muscle relaxers 3 times a day before surgery, that I was just tired and foggy, and it was difficult to think and keep on task, whereas I'm feeling much better now. But I'm also I'm able to sleep in a little bit, which is always nice to get some extra. Everybody recovers at a different pace. I have been through quite a few surgeries and have always recovered quite fast. So even my doctor said when I was there, he says most people can't pick stuff up off the ground, and they're still on pain medicines. He says you're doing great for just being able to do those things and not rely on pain medicines all day long, and that you're not in pain all day long. He says that right there that's great. And he says most patients are still on some sort of pain medicine. And I really wanted to make sure to get off of those as soon as possible. Well, I hope everybody else is doing well, and that this has been helpful for you in your journey, and I will make another video if anything else happens between now and my next appointment, which is in 2 weeks. That at that appointment, we'll be doing an x-ray. So this time we did not do an x-ray. The x-rays I've been showing are immediately post-op and prior to that. So be able to see the progress, and I start PT next week. So I'll have at least 4, I think I'll have about 4 appointments with PT and dry needling, either PT alone or PT and dry needling 4 times before my next appointment. And in addition to what I've already been doing, which I've already been doing some stuff at home. I was doing PT before I even went into surgery to prep me for surgery, so I would recover faster, and that also gave me some tools of things to do after, you know, that I've been doing lately. Working on my upper back, and it feels good and it loosens those muscles up. Just doing this, you know, squeezing your back together, like trying to fold it in, that it loosens those muscles and it makes it feel good. That was one of the ones that they told me, even in the hospital, they had me doing that, and you know, gliding your head back, and they made sure that I could go up and down stairs, because I do have stairs at home, which I have been going up and down my stairs. We have large birds that we have upstairs, so I get my bird up there. My husband gets his birds, because I can't get down the stairs fast enough with this on. I can't get down the stairs fast enough. For one of my birds, he gets mad, or one of his birds gets mad at me if I don't go fast enough. So, and he will bite me. So I don't want to even risk that or have anything happen. So I let him deal with his birds, and I deal with my bird, and I bring her down, and she's sweet and gives me kisses, and I give her treats, and we say hello, and then I sit down with her and I give her some pets and loves. All my other birds have been fine with the neck brace. All the birds have been fine with the neck brace. Some of them took a few extra days to get used to it, or was like, well, I had one of my birds, which is my most skittish bird, a cockatoo, of course, Goffin's cockatoo, to be exact, and he is a little scaredy cat of everything new. You know, if you're holding something, if you're doing something new, and with this, he was like, I don't even want to come near you, whereas normally he rushes to the side for pets, and I give him scratches. But he was like, no, don't want anything to do with you, and don't even try to pick me up. Not gonna do it. So he took a little longer. He took over a week to come and finally go, okay, you're okay. That thing on your neck is okay. You're okay to come to now. All the other birds, none of them had a problem. I have one of them that she loves to be around me, and I have to really watch her. I can't wear this around her because she'll chew on it. She likes to chew on the foam, so she's always trying to chew the foam and chew on this, and she wants to chew on everything. So I have to keep her really busy when I take her out. But she is my baby. She loves to get out and do things and play games, and she goes in the shower with me, and all that stuff, which but I can't let her near this. She will chew on it. So I do have another channel with all my birds on it, and I post sometimes on there. It was basically built around the meanest bird we have that doesn't like me, and me trying to become friends with it and work with it to be tolerable of me. So we have a love-hate relationship, but all the other birds pretty much, they're fine with me and they love me. So I hope everybody is doing well, and I hope your journey is going well. And if you have any questions, leave them below. Thanks. Bye.